Richard and Gary.
Richard and Gary.
And Sandy, but Sandy said she didn't know if she'd be able to be here. She
So
knew that.
we do have a quorum. Was the meeting properly posted?
Yes.
Thank you. The minutes of October 21st were distributed. Does anyone have a comment, correction? If not, I will declare those minutes approved as published. Public comment, we haven't approved the agenda yet, so we have an 8-point agenda, looking for a motion to approve. Mark Cooey, seconded by Mark. Mark and Mark, all those in favor signify by saying aye. Aye. Opposed, we have an agenda. Number 5, public comment, we're down to. See no one here? Public comment? Anyone online? I always forget to look there. Okay, Pine Valley Financials, Angela.
All right, so we'll start with the 8 farm balances, that's this one here. And you can tell for October, we were $1,036,934.69. So we were up over September, that was due to our census, less agency as well. And our census was like 64 last month, so that helped out quite a bit with our Medicare ranging at the average of 12. So that really helped us out last for October. Is the consideration for vouchers would be the next one then. There is a couple checks that Kayla did give me all, but I do want to bring them to your attention. That would have been our credit card statement. We did spend $600. We sent our RN CBRF managers to some training up in Green Bay. We spent another.
It would be helpful if you'd reference the check number and then we can follow
It
it.
was 11132, but it's not on this paper here.
Okay.
And then there was 637, we had to purchase some more vanity lights for the residents' rooms, for their bathrooms. We replaced 351, we replaced all the filters throughout the facility before winter in the furnaces. And then our total agency, which would be check 1134, 1135, 11141, 11148. Our total agency was up at this little pass. We were up over, it was 25,000 for October. We were up over 10,000 from last month, and that was due to 3 staff members being out on FMLA. And I had to have staff to take care of our residents. 2 of those staff members are currently back. And then I will, in my report, I have with the agency as well. We have check number 11154. We had to replace some dentures for a resident out there. They were accidentally dropped and broke. It was $1,948. So we had to replace that one. And then this came out of the capital land account. Richland, the highway department, we cut a check to them for $6,570.21. That was, they came out blacktopped up around the building and everything for us, so that check was also out. And that was it for the main vouchers on that one.
I'll ask because I'm chairman of the committee.
Yep.
Did we receive competitive bids for the blacktopping?
No, we did it in-house.
We did it in-house, yeah,
We did it
the highway.
in-house.
We just did it in-house.
Yep, to save money.
Yep.
Well, at the expense of private enterprise. I mean, we have blacktoppers, so.
We do, they wouldn't have come close to that cost.
All right.
I got a question for you, Angela. You know, we talked about a marketing plan long ago or whatever. Do we have a marketing plan, or is there Or is it just, you know, how does that work? Or how do we,
Or like,
for getting, what is the census? What is the maximum capacity that?
so in our skilled nursing side, we can hold up to 80 residents.
Okay.
So what Jen and Ryan do is they reach out to local hospitals. We did a open house
Mhm.
out there as well a couple months back. So we basically just call the hospitals, email the hospitals, let them know what we have beds available. And I mean, we went to the fair, we go to the senior
Mhm.
sites and stuff like that. So that's kind of the marketing for the census as well.
Okay,
This time of year, nobody wants to really go to the nursing home. It's holiday season.
Mhm.
I can guarantee you by January, everybody will start getting their hips or their knees and stuff done because it's winter time. They want to have it done. Right now, people want to keep their loved ones home the holidays. I mean, it's a trend all over. We are sitting at 62 still, so we're, you know, that's where our census is running at. So we're doing okay right now.
okay. So if we did, let's say something happened and we had, all of a sudden we were at capacity, would we have to get new staff for that additional, all additional people?
So we're hiring right now at full capacity.
Okay,
So we're still interviewing people. We are still hiring people because when we do get to 80, we're gonna be overstaffed now, it looks like, because we're still hiring, because I want to get to that 70, 75, and that's when we're gonna need all these people.
okay.
Yep.
So, and we got a marketing plan of sorts, let's say, it's more of a informal kind of
Yep.
plan. Okay, okay. Great.
That is all I have for that, for the vouchers.
So that takes us to the census report.
Yes, so our census report is, like I said, our CVRF is full capacity. We actually have 3 people on the waiting list, to be able to come. We are currently, our average census was 62. We were down a couple, from last month, and our Medicare is running at about an average of 9. With the census, we did have, what was it? We were currently at 59. We have 2 open referrals right now, so we're hoping to get them in by the end of the week. CBRF is fully staffed and full, and 3 people on the waiting list. And we did have 9 discharges that all went home through October. They rehabbed and went home, and then we had 7 admissions through the month of October. So for the administrator report, I kind of already went over census, matrix update. So we have started really training on our matrix. Our go live date, for our new system is December 2nd. We have like 3 or 4 trainings a week and they're like 3 and 4 hours long. So, we do have all our accounts our accounts receivable is all put in. They're starting now to implement all of our residents into the new system. And then the week of Thanksgiving, we will start our accounts payable, getting all of that transferred over yet. So, our go live date is, December 2nd. So that does give us 3 weeks before we would lose AHT to make sure everything is up and going. Staffing wise, our CBRF, they are fully staffed. Like I stated, we do have 3 agency CNAs. In the SNF side, 2 of those contracts will be up on 11/23. The other one will be up on 12/7. That one may change, but that's only like 3 weeks away because we do have the 1 person out on FMLA yet. And she hasn't been cleared to come back, so she's kind of covering that. We do have 2 CNAs, that we just hired, RAs. They are currently going to Fenimore, to the nursing home up there for CNA class, so they will be done on 11/21, and then they will officially be CNAs for us. We have helped them pay for it, so they've signed a 1-year contract with us that they will stay employed with us for at least 1 year. So those will replace all of that.
Are they local?
Boscobel area is where they were from, so.
Okay.
Nurses, we did just hire a full-time or an RN. She came in for orientation today. Housekeeping is currently staffed. He does have an employee that is retiring in January. But we are currently accepting, still looking at people to try to get in their dietary. She was having a little bit of struggling there, but we did just hire one full-time aide for her who came in for orientation today. She will start tomorrow. We hired a part-time aide for her, and she's gonna work half. She wanted full-time hours. I was unable to give her full-time hours in dietary. So she's gonna work half with Ann, and then she's gonna work half of her hours in housekeeping with Chad. So we just kind of combined the two departments together to give her full-time hours. Otherwise, she couldn't accept the job. So just kind of trying to think outside the box on how we can do that kind of stuff. I did just hire today a full-time lead cook for Ann, so that will make Ann totally staffed as well for the housekeeping. Our new staff members, we have Mark, he has accepted our full-time charge nurse position. We have Donna and Kayla, they are our two RAs that were coming CNAs. We have Maya and Sean, they are two full-time PCWs. We have Michaela, she is a part-time activity aide / part-time RA. Because there's another one where she wanted full-time, we couldn't do it, so we gave her half and half, and she's doing wonderful on both. Haley, we hired her, she's a full-time PMCNA. And then we have Stephanie, she's our full-time RN. And then we have Ashley, Andrea, who are gonna be dietary, and then we have Verdella, she's PRN, and she's coming back as a PCW. We do have one retiree this last month, it was Doreen. She retired after 31 years of service with us, so. So some kind of events that we have done out at Pine Valley, we had an employee appreciation at the Phoenix Center on 11/9. Staff got to enjoy free bowling, from 5 to 9 o'clock. So we had that out there. We had our safe trick or treat. We had about 220 kids walk through. That's not counting the adults, that's just the kids. We had a costume contest out there with all our staff as well. We had the River Valley Rafters. They presented, owls, I believe it was this time. They brought some owls in. That was a great attendance. The Ace Giving Tree, we just placed that up November 1st. So we got that up for the staff, our residents. Ithaca School Bus, they brought 4 busloads of kids out in their Halloween costumes to walk through the facility. So that residents really enjoyed that. And then we did participate with the EMS. We donated 5 baskets to staff. We kind of all divided up in groups and we donated 5 baskets to their fall festival, to help them raise money as well. We have a spot at the Rotary Lights for a Christmas tree, so our managers will be going out there some afternoon, get that all decorated up for them as well. So that's kind of the activities we've been doing out there. We've actually been very busy out there doing stuff, so.
That's a great schedule.
Yes, so monthly training, of course, we have our monthly training for all staff. Last month we had, falls with therapy. They came in, did a presentation on how preventing falls and everything. And then Chad and Clayton also did our fire safety where the staff had to go out and actually use a fire extinguisher and put out fires. So we did that as well. So that has to be done once a year. So I thought perfect time. It's getting that time of year where November's training, which is this coming Thursday, will be dementia training for all our staff. And then we'll be having a potluck. It's actually our theme is bring your favorite soup or dish, and then we're gonna judge it, and the winner gets bragging rights, so. It's just something we're doing. Kind of some projects that I've been working on. I have been looking at our addendum and stuff and kind of going through that, talking with Candace and stuff. Just trying to, do we really need this? Can we do this? So there may be some changes coming. Haven't, finalized nothing or anything, but just something I've been working on.
So explain the addendum. We have a countywide action plan. I can't think of the name.
Well, so what's interesting is we have several countywide policies. There's like 3 different countywide policies, and then several departments have a separate addendum with kind of departmentally specific items. And the goal is really to condense this into one countywide policy. We understand that departments may have different needs, but those can all be encompassed in one policy, vice having all these separate rules for different people. And so, as an example, one of the big ones, that we have identified in the addendum at Pine Valley is overtime is after 8 hours. Well, we're scheduling people regularly for 10 and 12-hour shifts, or at least we were, and some even for 16. That was really contributing to that ridiculously high overtime cost. So we need to look at the verbiage. So anything outside of your regularly scheduled shift or anything over 40 hours would then equate to overtime. So it's about how are we going to word these things to best benefit, Pine Valley staff. Sheriff's office staff is a whole other ball of wax. So again, we have to look at departmentally. So as soon as the wage study is done and the procurement policy is passed, next step in this whole big journey of ours is personnel policies. So department heads are already kind of looking at their addendums and looking at areas where they have concerns. And what I think we're going to do is bring in all the department heads to start going through all of the policies. And then, that's a lot of people, but see if we can get volunteers, that want to participate and maybe have a smaller committee that goes through, and then we'll work with Corporation Council after that to ensure that everything that we are doing falls within FLSA and all of the labor practices that we need to make sure we're in compliance with.
How big is the addendum? How many we're talking
I
about?
think it's like 16 pages.
16? No, that's not
Yeah.
that bad.
It's not too bad. I think I'm on page like 5.
Well, there's a lot in that
Yes,
one.
it's a lot.
That is, and a lot of the practices too have carried over from union days, and we're non-union. So it's really about cleaning up language and bringing consistency then to all of the non-union, because that's why everyone kind of had their specific things. And the only unions we have left are the law enforcement union, and it's not even the jailers. It's really only the patrol staff, patrol lieutenants, that union, so.
I am also working, with our laundry contract, because it will end on December. I have 2 different companies, the current company that we're at, and then I'm also looking at Van Box. I did get a quote from them as well. Plus, I'm also getting pricing on, because we have a lot of stuff still out there, possibly bringing it back in-house. What it would cost me to get new staff, to buy some linens, to, buy a couple washers, dryers. So those are the 3 options that I'm looking at. Justin has been great and been helping me get, the staffing quotas and stuff like that. So, I'm working on it. And then I'm also in contact with, healthcare workforce training company. So this is a company that will come in and do, CNA training at your facility. They will do med tech training. They will do all the CBRF training. And all you basically have to do is set up a classroom for them. So you have to have one room that is specifically only a classroom. They have to have their own entrance, they have to have their own bathroom, and then they also have to can't walk by a residence area, because these are people. If you do host a class, you get $1,000 from this company to host this class, along with $250 for every student that you get through the class. So it's something I'm just working, and all it costs us to do this through this company is set up a classroom. Well, everything that's on our list is everything we have out there, because we're a nursing home. It's your beds, your supplies and stuff like that. So we wouldn't have to purchase any supplies or materials at all. So I am working with them. I'm trying to get that. That's something that we could offer to our community. We could offer to other areas, and we could host these classes. So that is something else that I'm working on.
Do you have a space that satisfies all the
Well,
requirements?
I do, but I'm just trying to figure out where I could put some stuff. I do have an area that I'm thinking of. We would have to do some moving around of stuff like that, but we do have an area that we could use, so. Yeah. And that is about all that's going on in Pine Valley.
Okay, we kind of skipped over after the census recap, the financial report, but you already covered
Yeah.
most of that, I think. So the administrator's report we just had. I was questioned tonight. In an adjoining county, there's news that the nursing home there decertified. I'm not sure what that entails. Some beds
So that means.
And now the
that-
rumor is we're going to do the same thing.
No,
No,
I
we're
have not heard
Haven't
that.
heard
We are doing that, so what that means is, and I know what county you're talking about.
Mhm.
So there's 75 beds, they are going down to 50 beds, I believe, or 58 beds.
Yeah.
And what it is they're giving those beds away. So once you give a bed away, good luck at getting that bed back.
Yep.
You'll probably
They're
never.
doing it for
They're
lack
doing it because they are struggling with staffing and they are paying more in
Staffing.
agency. I know the administrator that works over there, we actually went to class together. And that's what she had stated is that they just don't have the staff and they're not getting applicants and stuff like that. So we have been very fortunate out there and thinking outside the box with myself and Justin and Jesse. We've really been thinking outside the box. How could we get these people in here? That's why we're doing multiple departments. That's why we're hosting these classes. Anything, you can hire somebody and have them be an RA for 3 or 4 months before they even have to take the class, because are they even gonna like it, So, and the CNA class and stuff, they're expensive and people, you can't afford it, so that's why we're trying to think outside the box.
What does RA mean? What's the-
Right, that is a resident assistant, so they can basically do anything in the nursing home except for personal cares. They can't touch that resident. I mean, they can push them like to an
I
activity.
was an RA once.
Yeah, I mean.
Back
they-
in college.
Yeah.
Different thing.
So, that's why we're trying to think outside the box, so we do
Seems
have
like
staff.
yesterday, Marty.
Yeah. it was. Okay. Well, that brings us down to number 8. Gary's not here.
Yeah.
I'll take over for Gary.
Wayne, motion.
I'll second that.
Do we have a second, Mark?
Yep.
All those in favor of adjournment, signify by saying aye.
Aye.
Opposed? We are adjourned. Thank you. Coming out on this evening. It'll be a harder task.